Joining us today is Dr. Joanna Lamberts. She is a dentist practicing in Sault Ste. Marie since 2012. In practice, she focuses on oral health for the whole family. Welcome, Dr. Lamberts. Thank you for joining us today.
Thank you for having me.
So tell us a little bit about yourself and how you became interested in dentistry.
I think from a very young age, I always had an interest in art as well as science. And throughout high school, especially, I discovered dentistry as a way that I would be able to combine those two things. I'm originally from Sault Ste. Marie, and growing up here, my mom was a nurse, so I always had healthcare surrounding me. But she then went on to become a small business owner, and that really drove me to want to work for myself. My uncle is Dr. Michael Nanny, who is a dentist in town, and he was my dentist. So I grew up in this, going to this dental office that I'm in now. And I was very inspired by him to go into dentistry because of his tremendous impact that he was able to have not only with his patients, with his staff, but the community at large. So for most of my adult life, I lived in Montreal and then Vancouver, but then moved home about 7 years ago now to start practicing with my uncle, Dr. Michael Nanny, and my partner later joined me here. We've settled down. We now have a 3-year-old and an 8-month-old, and I have since taken over the practice.
Wow, that's quite an amazing journey that dates all the way back to childhood for you. And it's really interesting to hear. Your uncle's name is actually one that I've heard around the community with, really positive feedback over the years. He wasn't my dentist growing up, but I've heard his name in positive light over the years. It's really wonderful that you were able to join him in practice and then take over.
Yeah, and I like to joke that I was probably not the best patient as a child. I fortunately had the balance of an uncle who's a dentist, but my dad, as a side job, owned candy machines, and we had an entire candy room in my basement growing up. So I was not the cavity-free child by any means. I was here pretty regularly, and I think that's kind of given me a little bit of my passion to working with kids and that type of thing.
Yeah, makes sense considering. And I think, from having the challenges that you may have had with oral health growing up, I think it probably puts you in a place of empathy for the patients that you're working with as well.
Oh, absolutely. And when parents, we often encounter, kids getting their first cavity and parents will be absolutely devastated. And I'm very empathetic to that, but at the same time saying, oh, your mouth is so much better than mine as a kid. In one cavity, I had so many more than that. And so I think that it gave me a really great perspective. A lot of people that I went to dental school with had the perfect smile, 0 cavities. I was never that kid.
Yeah, that's an interesting point that you make as well. And even, to say that you were at the office often, but obviously you had fond enough memories for you to pursue this as your passion in your career.
Absolutely. And I was so lucky to, when I came on, have a number of the staff that worked with my uncle still working here. And so these people, not only my uncle, but a large portion of his staff were the people that took care of me growing up that I then got to work with. So it
That's
was a
that's really amazing. And it sounds like it, with dentistry, it is something that you're very passionate about. What do you find most rewarding about your work?
Um, I would have to say the people for sure. The patients that I get to work with, getting to develop that relationship with them and getting to know them over, the course of their childhood or their lifetime. I find that so tremendously rewarding to have that relationship with them, as well as my staff. I'm so grateful to work in such an amazing office with such great people. And I also really find it rewarding that I have the opportunity to invest myself in the community, to have an impact hopefully on the oral health of those around me, and to also at the community at large by investing myself, my time, my effort into different areas in the community, whether it be fundraising for the Sioux Area Hospital or in the Dental Society or our Dental Study Club.
That's amazing. Well, thank you so much for sharing that. And, oral health is something that people may struggle with and might not have a concept of what good oral health looks like. Can you define what that is for us?
First off, I would say that oral health is a critical aspect to overall health. So we can't necessarily think of oral health as a separate entity because it's interconnected to so many aspects of our overall well-being. But I would say that the good oral health is the absence of chronic illness and disease and infection. So in dentistry, there's two main illnesses that we deal with, caries, or as people would refer to it as cavities, tooth decay, and periodontal disease or gum disease. But there are a number of other things that we deal with other than those two major illnesses, including oral cancers, different mucosal lesions, temporomandibular disorder or jaw pain, and smoking cessation or counseling patients as to how to quit smoking. All of these illnesses can cause, infection and chronic inflammation that can have an impact on your whole body and your overall well-being. So to me, good oral health is the ultimate self-care. It's very simple steps that when done consistently can prevent serious oral disease. It's proper preventative care, like the basics of brushing and flossing that you've heard over and over again throughout your childhood, at school, at the dentist, as well as seeing your dentist regularly to help you avoid these chronic illnesses. And it's at my office and with my colleagues, our job is to empower you as the patient as to how to learn more about your oral health and how to take a stake in your own self-care.
Very true. And I like the way that you define it, the ultimate self-care.
Yeah, and something we don't always have enough time to do, but something that we really have to prioritize.
Very true. I think prioritization at times that is what creates the importance of something and the urgency to do something rather than time, because we all have the same number of hours in a day, right? But if we're prioritizing our self-care, and oral care is a really important part of that, it's going to happen.
Yeah, absolutely. And it is something that in terms of the investment of time and energy, what you can invest in your preventative care and your self-care is much less time and energy than what it takes trying to overcome these chronic diseases that, the lack of self-care can lead to.
Yeah, very true, which I think is really important to say, because if you're investing the time and energy now, it's going to have a much greater payoff in the long run.
Absolutely.
Yeah. So what are the most impactful habits you would say for good oral health that we can develop? And again, this is something that we hear over and over, but I also want to emphasize why they matter.
So one of the most impactful habits that you can gain is learning how to properly care for yourself. And I say that as a habit because it's an ongoing learning that has to happen. So as we take care of our teeth, we usually learn how to brush our teeth and brush and floss our teeth as children. Well, a child's teeth and your oral health needs as a child is dramatically different than what it is as an adult. And then when you encounter disease, whether you're someone who is more prone to getting cavities or periodontal gum disease, that type of thing, how you take care of your teeth needs to evolve with that as your needs evolve. So one thing that I often tell patients is to take a step back and question your technique, question your basics, because there's always opportunities for us to improve our oral health and to learn more about it. Coming back to what we were saying about self-care, it's about making it a daily priority. It's not necessarily the number one thing that you want to prioritize. Not everyone does, but at the same time, it's so important. We talked a lot about oral hygiene. So another component that's involved with our risk factors are things like diet. How much sugar are you consuming? And what ties this all together is having regular checkups done with your dentist to make sure that you can catch disease in the early stages and work together towards prevention.
Very true, because if you can intervene at an earlier stage because there's an awareness, because something was detected, it's usually easier, if we're talking even across healthcare, to be able to deal with the problem early than it is to deal with something where it's later stages.
One of the things that's very unique to dentistry is that most of the diseases that we deal with are very slow processes. So a cavity to go from, the start of a pre-cavity to a large cavity that needs a root canal, that doesn't happen overnight. So we do have time to catch this, change the disease process, and find ways to help you reduce your risk of getting further cavities. But we need that intervention at the dentist's office to be able to catch those early signs, because they're not easily detected by the naked eye.
Which is great. That's a really great point, how screening really matters for that and having regular checkups. Could you tell us who are the typical patients or clients that you see in your office?
I am a general dentist, so we have patients from all different backgrounds with a variety of oral health conditions. I'm very lucky to be in a practice that has been well established well before my time. My uncle, Dr. Michael Nanny, owned this practice before me, but actually Dr. Lulu Kenda owned it before him. So I have patients that I am the third dentist that they're seeing still in the same office, or they're the grandkids and their grandparents came to this office. So it's a long lineage that's a very beautiful thing to be a part of. And the majority of our patients are lifelong patients that have really made prioritizing their oral health part of their routine. But we do have a number of new patients arriving each week, often who are realizing that they need to make some type of change and start taking better care of their teeth. In Sault Ste. Marie, as our population base, what I found different from other areas that I've worked in is that we have a large portion of patients in our community that are retirees and elderly, and they often have very unique and significant oral health challenges because tooth destruction is often cumulative over the course of a lifetime. And for a lot of these individuals, preventative dental care, the technology and the knowledge we had wasn't where it is now today. And so I love the fact that now seeing a new patient, I can say that I am capable of giving you the tools and you are able to take care of your teeth well enough that you are going to be able to keep your teeth for your entire lifetime. There was a point in time in a lot of these patients' lives where that wasn't the case and the technology wasn't there. So they have a very unique set of needs in terms of dental care, replacement of teeth, and that type of thing. We often see many new young families in our practice. In my office, we see a lot of children. I really enjoy treating them. And we are big proponents of seeing kids early. So the Canadian Dental Association recommends that a child should see the dentist by their first birthday. And with that, coming back to what we were talking about, preventative care, getting upstream of any of those diseases, catching any problems before they become large ones, the younger the kids are when we start to see them, the more of a positive experience coming to the dentist is. And we also see a number of patients with significant dental fear. And these are, a unique group of patients that are trying to prioritize their health while battling anxiety coming to our office.
So speaking to the point about dental anxiety, what advice would you have for someone who is suffering from severe dental anxiety?
The main message I would want to get out to people that are seeing the dentist or maybe not yet able to overcome the obstacles of seeing the dentist is that you're not in it alone. Dental anxiety isn't something that's best managed on your own. And as a dental health professional, that is part of our training, and what we're really here for is to be able to help you through it and give you tools to be able to make it a more positive experience. If you're not yet able to see a dental professional because of your individual obstacles, then I would recommend reaching out to your family doctor, to a therapist, to friends and family. Dental anxiety is best managed with a team of support.
Great. I think that is so helpful to think about because sometimes that could be quite a barrier for people, maybe even walking through the door. But I think it's so important, in a shared philosophy of mine too, that patients always do best in terms of their outcomes when they have a healthcare team to support them with all the different aspects of their care needs.
Mm-hmm. Absolutely.
So what are some of the common obstacles that women encounter who are struggling with oral health?
Well, one that we've discussed is dental anxiety. Another one that is often seen in our community is the limited access, whether that be more vulnerable populations, patients from lower socioeconomic statuses, and unfortunately, dental care can be very cost prohibitive for a number of people. But as women, I find that we're often placed into the role of caregiver of the family. And unfortunately, all too often that involves a little bit of putting ourselves last. So that is a huge barrier I find for women and mothers in our office. Often I'm treating full families for many years and get to know the mom very well. And then all of a sudden, we realize that she has never actually been seen as a patient. So these moms taking the time to invest in the oral health of their families, to find a dentist they're comfortable with, to make the appointments, to bring them every 6 or 9 months, and yet still not prioritizing themselves happens all too often.
Very true. And I see that so often in my office that sometimes women that are coming through the door eventually to take care of themselves that may be starting to deal with chronic disease concerns, they're waiting to come in until their children are grown up because they've put themselves aside for so long. But I think it is really important to consider that alongside the appointments that you're scheduling for your children, that your own self-care is really important and matters too.
Yeah. And there's a lot of really well done research out there that shows that your oral health has a tremendous impact on the oral health of your children. Not only are you the one who is teaching them all of their oral health and oral hygiene habits, you're the one helping them with their diet and developing good habits with that. But dental fear and anxiety is often inherited. So if you are someone that is anxious about coming to the dentist and have these unresolved issues, that often develops into a fearful child. So the more that we can get the entire family on the same page in terms of their oral health and prioritizing it, the better off everyone is in the family.
Yeah, thank you for sharing that. I think that's a really important consideration to keep in mind for women because children are learning from you by observation. And like you said, the research shows that.
Mhm. And, you know, we talked about habits and about diet, which are extremely important aspects. But one little known aspect of dentistry is that it is an infection and a chronic disease. It's the most common chronic illness in children in Canada are dental caries or cavities. And so these cavities are brought about by a bacteria that's introduced into children's mouths. And that bacteria is usually given to them by their caregivers. So if you're a mom not necessarily prioritizing yourself with a lot of active decay, your children are more likely to get that bacteria from you and end up with cavities because you're ignoring your own oral health. And so it's actually through transmission from usually a caregiver that the children get the bacteria that causes cavities. And the more time and effort you put into controlling that bacteria in your own mouth and taking care of your own oral hygiene, the less of a risk your children will have of getting cavities.
That is such an eye-opening point. I think that will be really insightful for so many women to hear and to maybe push them to prioritize their own self-care and their oral health more.
Absolutely. And I don't love the fact that all of us as women, as caregivers, as mothers, sometimes need that little push that taking care of ourselves actually ends up helping someone else. But sometimes that is what we need to be able to say, oh no, wait, I need to take a step back and really try and prioritize myself in this aspect.
True, it can be so motivating. I want to hear from you too. What are some of the common dental myths that you hear? I'd really like to give you the opportunity to set the record straight.
So one that I hear often is that dental care is just about your mouth, and we touched a bit on this before, but many systemic issues are directly related to your oral health, including very common illnesses like heart disease and diabetes. Something like the correlation between diabetes and gum disease is very well known in the research, and the more well-controlled your diabetes are, the healthier your gums are, and the more well-controlled your gum disease is, the better your diabetes, your state in terms of your blood sugars will become. So there's a huge direct correlation through a number of systemic illnesses that really need to prioritize oral health. And with that, like talking about children as we were, a lot of people think, oh, well, it's just baby teeth. And really, these primary teeth, these baby teeth, set the foundation foundation for a lifetime of oral health. And taking care of them is very important, not only in terms of spacing of teeth, of orthodontics, but controlling that bacteria so that when the adult teeth come in, they're not going to be more susceptible to getting cavities as well. Another myth that I often hear about is fluoride. It's often a very touchy subject for a lot of people, and it gets a very bad rap. And it is something that it's a naturally occurring element that in very low doses can be tremendously helpful in reducing cavities, especially in vulnerable populations, including children or people with a really high risk of getting cavities. So I really love the phrase of the dose makes the poison. There are so many things that we encounter in life that a really high dose or a high amount of it is very unhealthy, but a very low dose shows a tremendous amount of benefit. And that's the case with fluoride. There's a lot of really well done research out there that in terms of the doses we're talking about with fluoride and your oral health, that there's a tremendous amount of benefit with very minimal to no adverse effects. And the last myth I'd like to touch on is to beware of fad oral health products. I, on a probably weekly basis, get a patient asking a question or a Facebook message from a friend of, will this work? Most of the time it's people trying to get away without flossing and trying to find something else instead of flossing, because it's not everyone's favorite habit. I understand that. But nothing is more important than the mechanical removal of plaque and bacteria from your teeth. And nothing can replace brushing and flossing. There are other tools or other gadgets that in certain individuals might help your overall health, but nothing to actually replace brushing and flossing. So if you're looking at mouth rinses, water picks, oil pulling, all of those things can play a role in improving oral health for certain individuals, but can't replace brushing and flossing. So something to definitely chat with your oral health provider on.
I appreciate you setting the record straight on all those points, because I think it's really important to hear, especially from a dental health professional, that like those basics and foundations, you can't get around them, but you may be able to add things in addition.
Absolutely. And there are some products out there that can cause damage. So one that we're seeing more and more damage from are charcoal-based toothpaste, which most people think it seems like it's natural and that it might have a dramatic whitening effect, but it's a very, very abrasive product. So it's almost like taking a very mild sandpaper to your teeth. And so if you're using it once in a while, probably not too bad, probably won't have much of an effect on your oral health, but we're starting to see more and more patients that use it very regularly, and we're getting a lot of what we call rebound staining. So they're roughening their teeth to the point where the surfaces are rougher and collecting more stains in the end, and then come to us to try and find solutions. So in terms of trying new products, different fads, that type of thing, it's really nice when you're seeing your dentist regularly, and at your regular 6 or 9 month appointment, it can be something that we can discuss.
Mm-hmm. I really appreciate you pointing that out. That was something that I'm definitely not aware of. So I'm so glad that you're sharing this insight, which is something you'll see often in your line of work. On that same note, I have another question that I think our audience might be thinking of right now as well. Charcoal, you said, could be abrasive on the tooth surface. What about baking soda? Does it have the same effect?
It's, again, very abrasive as compared to most whitening products you would use. So it is something that used, in a very moderate amount, not every day, can have some whitening benefits. But the real whitening products that we would use in our office or that you would get with a a teeth bleaching system are actually more mild in a lot of ways than looking at these more natural products like baking soda or charcoal, and have less of an issue with rebound staining. I definitely think that I see a lot more rebound staining with the charcoal use than I would with the baking soda use, but definitely something to be aware of, kind of going back to the everything in moderation, right? Except fluoride, use that every day.
Well, thank you so much for clarifying that. I think it's really important to bring up because, like you said, there are products that might trend, but they could actually be harmful. And now I'm wondering too, because the topic of resilience is something that is near and dear to my heart, and it's also a topic that is really important to women's wellness. What does becoming more resilient mean to you, and how does it apply to the patients that you work with?
To me, resiliency, I would say, is the ability to face challenges with grace. And in my line of work, what always comes to the forefront, like when we were discussing dental anxiety, is that doesn't necessarily mean that you have to be facing those challenges alone. Developing resiliency is something that my team and I work with our patients towards in the dental office, whether it's trying to combat chronic illness or conquer dental fear. It's something that is more easily surmountable with the help of health professionals. So don't hesitate to discuss your fears, anxieties with your dental health professional. And if you're not seeing your dentist, therapists, family doctors, anyone in your support system, the more you prioritize your oral health at home and your preventative care, the more of a positive experience going to the dentist will become. But in my experience, women are the most resilient patients I have. I always joke with new moms that they are the easiest patients I have to work on. Maybe it's because it's the only time they get to sit down that day and have a bit of a, coming to the dentist suddenly becomes a break. But when we are able to empower women to prioritize their own oral health, we can see tremendous changes in the course of the disease that they're experiencing. But all too often we see women leaving their own health by the wayside when prioritizing the health of the rest of their family over their own.
Very true. And, I appreciate everything that you've shared today and your contribution to this conversation about elevating women's wellness. I have no doubt that what you shared today is going to have a really positive benefit on the lives of not only women, but their families and children as well.
Thank you so much for having me.
Thank you.